Hello everybody. Today I'll talk about a very important system in your body which is called the lymphatic system. Why lymphatic system is important? Because the lymphatic system is responsible for immunity. Immunity is the defensive functions of your body. So your body fights against the antigens with the help of the lymphatic system. So first we'll talk about the functions of the lymphatic system, then we'll see the parts of the lymphatic system, then we'll talk about the lymphatic vessels. Lymphatic system is another circulatory system in the body. You know that the main circulatory system is the blood circulation, cardiovascular system, but the lymphatic system has fluid, and that fluid circulates inside the lymphatic vessels or lymphatic system. That's why this is another circulatory system in the body. So we'll see the lymphatic vessels, and then we'll talk about the properties of the lymphatic capillaries, how the lymphatic capillaries are different than the blood capillaries. We'll see the differences between the lymphatic and the blood capillaries, and then we'll talk about the large lymphatic vessels and where the lymph is finally drained into the veins or venous system. Okay, we'll talk about the large lymphatic vessels. Those are called the ducts. There are two ducts or large lymphatic vessels. We'll talk about those two ducts. Then largest lymphatic duct is called the thoracic duct. So among those two large lymphatic ducts, thoracic is the bigger one or larger one, and another one is called the right lymphatic duct, that is the smaller one. We will talk about the lymphocytes, one type of white blood cells, and lymphocytes could be two different types, T and B lymphocytes, and we'll talk about their functions. We'll talk about the structure and function of the lymph nodes, their locations, and other lymph organs, tonsils, thymus, spleen. Then we'll talk about the structures in the wall of the late part of your intestine. Those lymphoid structures are called the Peyer's patches, and we'll talk about the lymphatic vessels called the lacteals. So first, the parts of the lymphatic system. Lymphatic system consists of the lymph organs. Now the lymph organs could be small lymph organs, those are known as the lymph nodes, and the large lymph organs, spleen, thymus, tonsils. So these are the large lymph organs, and lymph nodes are small, like nodes, small and distributed throughout the lymphatic system, many in number. Okay, in some areas in your body the lymph nodes are more clustered. For example, in your cervical or neck area, in your inguinal or groin area, in your axillary or armpit area. Okay, so in those areas the lymph nodes are more densely present or more clustered. However, the lymph nodes are many and distributed throughout the lymphatic system. You have the lymph nodes everywhere. Large lymph organs are large and only few. You have only one spleen, one thymus, and few tonsils. So those are large. And then, so these are the organs. Number one, organs, two types, small and large. And then you have the lymphatic vessels. Okay. Now the vessels are also called lymphatics, and vessels include the capillaries. The smallest lymphatic vessels are the capillaries, and capillaries drain the lymph or fluid into the collecting vessels, and then collecting vessels give the lymph to the trunks, and the trunks give the lymph to the ducts. So smallest are the capillaries and the largest are the ducts. There are two ducts. One is called the thoracic duct. This is the bigger one, right? 3/4 of your body area gives lymph to the thoracic duct. So 3/4 part, 75% of your body gives lymph to the thoracic duct. And another one, the smaller one, is called the right lymphatic duct. 1/4 part of your body, upper right quadrant, gives the lymph to the right lymphatic duct. And from these lymphatic ducts or large lymphatic vessels, the lymph is given to the venous system. Which vein receives the lymph? From the thoracic duct, left subclavian vein under the clavicle, right? Subclavian vein. And from the right lymphatic duct, right subclavian vein receives the lymph or fluid. So finally, the lymph or fluid circulates. After circulating inside the lymphatic system, the fluid enters into the veins. Which veins? The subclavian veins. Okay. Now we'll see the lymphatic system. In this picture, you see the lymph nodes. The green lines are showing the lymphatic vessels. So lymphatic vessels are everywhere in the body, and you see the tiny round structures. Those are the lymph nodes, and lymph nodes are clustered in few areas. For example, you see here axillary area that I mentioned. You have more lymph nodes in this area, and another place is the inguinal lymph nodes. In the groin area you have clustered lymph nodes, right? And cervical lymph nodes, you see cervical lymph nodes in the neck area. Also in couple other places lymph nodes are more clustered. One is here, you see lumbar lymph nodes in this area, right? And pelvic area also has more lymph nodes. So lymph nodes are everywhere, but in some locations more densely present. And other lymph organs, here you see large lymph organs, tonsils, thymus, spleen. Okay, so those are the large lymph organs. Now the functions of the lymphatic system. As I mentioned, lymphatic system is responsible for immunity. What is immunity? Immunity is the ability of your body to protect itself, its own defense mechanisms or functions. That is the immunity. You know that human body has the ability to fight against the antigens, the harmful elements that can enter from outside of the body or can be produced inside the body. So any harmful element that can cause harm to your body would be considered as an antigen. It can come from either outside or can be produced inside the body. Example of outside antigens: bacteria, virus, right? Those foreign bodies enter into your body from outside and try to harm your body. You all know that. So good examples are microorganisms that try to invade into your body from outside. However, the antigens can also be produced inside the body. Example, uh, abnormal cells in the body. For example, the tumor cells or cancer cells. Those are unhealthy abnormal cells that try to harm your body, right? So those are also considered as antigens, although they are your own body cells, right? But harmful cells. Also, if you receive tissue from another person's body, like tissue transplantation, that another person's tissue or cells will be considered as antigen in your body. That's why the chance of rejection is very high. Mismatched blood transfusion, you know that if you receive a blood from another person's body, that blood is not your type, then the red blood cells of the donor's blood will be considered as antigen in your body, and your body will destroy them. Okay, so that's why you must get blood, same type blood from the donor. So you see that antigens could come from outside or could be produced inside the body, but the common property is that the antigens try to harm the body, and your body will produce antibodies against the antigens. So this is very important, that antigens try to harm your body, and in response to the antigens, your body produces antibodies to destroy them. Okay, that is the immune response of your body. Now, who are the main warriors in your lymphatic system? Two things are the main warriors or fighters. One is the lymphocytes. These are the white blood cells. Lymphocytes fight against the antigens. And number two, antibodies. Okay, so these are the main warriors that fight the antigens. Lymphocytes could be two types, T lymphocytes and B lymphocytes. Okay, and T lymphocytes and B lymphocytes, they get matured or immune potent. That means they learn how to fight the antigens in two different areas in the body. T lymphocytes, after the lymphocytes are produced by the bone marrow, so we know that bone marrow is the site of the blood cells. So bone marrow produces new lymphocytes, right? And these new lymphocytes are immature lymphocytes. They don't know how to fight. Some of these lymphocytes will be sent to the thymus, and inside the thymus they will get their training, which is called the immunopotency. And once they will get their training or immunopotency in the thymus, those lymphocytes are now called T lymphocytes. Remember, thymus starts with T. So T lymphocytes. These are the mature lymphocytes. They know how to fight. And some lymphocytes will go to the bone marrow to get their training. And after they get their training, when they will come out, they will be considered as B lymphocytes. Remember, bone marrow starts with B. Makes sense, right? So T and B lymphocytes. And how they fight? T lymphocytes mainly do phagocytosis. That means engulf the antigens. Okay, so if this is a T lymphocyte, what will happen when the antigen will come close to it, the T lymphocyte will engulf it, take it inside and destroy it. Okay, so that is called the phagocytosis. However, the B lymphocytes do what? B lymphocytes will not do phagocytosis but will secrete antibodies. Okay, and the antibodies will destroy the antigen, will get attached to the antigen and will destroy it. Make sense? So secretion, by secretion of antibodies, and then antibodies will get attached to the antigen and will destroy it. So they fight differently. Make sense? Now some B lymphocytes produce antibodies, right? Some B lymphocytes are converted to another type of cells. Those are called the plasma cells. And plasma cells can produce huge amount of antibodies. So B lymphocytes themselves produce antibodies. However, some B lymphocytes will be converted to plasma cells, and plasma cells produce plenty of antibodies. Okay, these are the lymphocytes, one type of white blood cells. Now we'll see the lymphatic vessels. The smallest lymphatic vessels are the capillaries, lymphatic capillaries, and the capillaries, here you see the green blood vessels are the lymphatic capillaries, and the red ones are the blood capillaries. You already know about the blood capillaries. Blood capillaries form the capillary bed. So you see they get connected to each other, right? Blood capillaries, and form what? The capillary bed. However, if you see the lymphatic capillaries don't form anastomosis or network. They are dead-ended. You see, that means they are not connected to other capillaries. So one difference between the blood capillaries and lymphatic capillaries is in case of blood capillaries form network or capillary bed, but lymphatic capillaries are dead-ended, blind-ended, no anastomosis, right? Number two, in lymphatic capillaries you will see many valves, and those valves are, if I just take this part and see here, what I'll see mini valves like this. These are the mini valves, you see, and open inwards. So you have the tissue here around the capillary, right? These are the cells in the tissue, and in between the cells you have the fluid called the interstitial fluid between the cells in the tissue, right? So interstitial fluid will enter into the lymphatic capillaries, and since there are valves, when the pressure will increase here outside, the valves will get opened. Which way? Inwards, you see, inwards, and the fluid will enter into the lymphatic capillaries. So the fluid will enter from the interstitial spaces. That interstitial fluid you see shown by arrows, interstitial fluid will become the lymph. So in blood capillaries no valves, but in lymphatic capillaries you have many one-way valves. They open inwards, right? Let the interstitial fluid get in, and once the interstitial fluid is inside, that is called the lymph fluid. Okay, and the capillaries will give to the collecting vessels, and then collecting vessels will pass through the trunks, and then finally will be given to those two large lymphatic ducts, the thoracic duct and the right lymphatic duct. that I mentioned earlier. Okay. And in case of lymphatic capillaries, another thing you will see not shown here, the capillaries are anchored by the filaments. Okay, so thin string like structures arise from the capillary wall and tie the capillaries to the tissues. So we can say filaments. No filaments in blood capillaries, but in case of lymphatic capillary you have filaments, okay, to anchor or keep the capillaries in right place. So here you see some properties of the lymphatic capillaries. I mentioned blind-ended or dead-ended, no capillary bed or network. The diameter of lymphatic capillaries is larger than the blood capillaries, okay, and one-way mini valves that permit the entry of the fluid, interstitial fluid, okay. And now let me show you again here what happens if the tissue in this area is infected. That means what? You have microorganisms there, right, in the tissue, and that, let me draw the microorganisms here with red color. So these are the, for example, bacteria infected your tissue. So what will happen? The fluid, interstitial fluid, when the fluid will enter into the lymphatic capillary, it will take these microorganisms, bacteria, inside the lymphatic system with the fluid, right? So that's how the lymphatic system takes the antigens inside, and then when this fluid will pass through the lymphatic system, you have the lymph nodes, other lymph organs, right, large organs, tonsils, thymus, spleen. They are filled with lymphocytes, and the lymphocytes will destroy. How the lymphocytes will destroy? I just mentioned T lymphocytes and B lymphocytes and how they destroy the antigens, right, by phagocytosis or by producing antibodies. So that's how the lymphatic system works, okay. Here this is a better picture that you can see the mini valves. So you see the valves get opened. So these are the mini valves, okay. We'll let the fluid get in, and with the fluid some microorganisms or antigens, if they are present, they will enter, okay. Okay, now the lymphatic vessels are like the veins in your body. However, there are some differences between the veins and the lymphatic vessels. What are the differences? The larger lymphatic vessels have more valves. You know that inside the large veins you have the valves that I mentioned before. In the lymphatic vessels you also have valves, but in larger lymphatic vessels you have more valves than the veins, okay. And the lymphatic vessels wall is thinner than the wall of the veins, so that is another difference. And in case of lymphatic vessels, since you have more valves, the valves are located close to together, and where the valves are present in that area, you will see kind of bulging or dilatation, okay. So the area gets dilated. Low pressure inside the lymphatic vessels. That means inside the lymphatic vessels the pressure of fluid is less than inside the veins. You know that pressure inside the vein is lower than the pressure of blood inside the artery, and the pressure inside the lymphatic vessel is even lower than the veins. Now Inside the lymphatic vessels, you have the valves, and those valves prevent the backflow of the lymph. In your veins also you have one-way valves will prevent the backflow. Okay, this is another important thing. There are two sets of lymphatic vessels, superficial and deep. Okay, superficial lymphatic vessels run with the veins in the body. That means you know that veins are located more superficially than the arteries. So superficial lymphatic vessels run with the veins, and deep lymphatic vessels run with the arteries. Arteries are in the deeper part than the veins. Okay, so here you can see a vein, artery, and lymphatic vessels. You see the differences. The wall of the artery is very thick, the wall of the vein is thin, but the wall of the lymphatic vessel is even thinner. Okay, and here you see the dilatation here, you see dilatation here, right? Expanded. So where the valves are present inside, you will see slightly dilated in those areas. Okay. Now you remember I said the lymphatic capillaries collect the interstitial fluid, so the fluid enters into the capillaries, right? Then the capillaries give the fluid to the collecting vessels. Makes sense? Collecting vessels, and then collecting vessels, from the collecting vessels the fluid will pass through the trunks. Trunks are short, wide vessels, and then the lymph is given to the ducts. So ducts are the largest lymphatic vessels, and there are two ducts I mentioned. Thoracic duct, the bigger one, 3/4 part of your body gives lymph to the thoracic duct, and right lymphatic duct is the smaller one, 1/4 part of your body, which is the upper right quadrant, gives fluid to the right lymphatic duct. Here you see this is 1/4 part, upper right quadrant. That means what? Upper right limb, upper right part of your trunk. This is the trunk of the body, so upper right 1/4 of the trunk, and half of your head, the right side of your head. So 1/4 part, right? And 3/4 part, that means 75%. That means the whole lower part of the trunk, two lower limbs, left upper limb, left half of your head. From this 3/4 part, the lymph goes to the thoracic duct. So right lymphatic duct from 1/4, and thoracic duct, which is bigger, from 3/4. Okay. Now if you see the thoracic duct, you see this is the thoracic duct, this green vessel. Okay, and if you see the lower end of the thoracic duct, you see it is expanded. So thoracic duct, actually I am drawing here, this is your vertebral column or spine. Okay, and the thoracic duct is just lies on the vertebral column, and the lower end of the thoracic duct is what? Expanded or dilated like this, and this is called cisterna chyli. You can see here, cisterna chyli. And from the lower part of your body, like from your legs and lower part of your trunk, the lymphatic vessels give the lymph to the cisterna chyli. Okay, so it collects the lymph from the lower part of the body, and then the thoracic duct will take the fluid, also collect the fluid from left half of the trunk, half of the head, right, and will give the lymph to the left subclavian vein. So this is the left subclavian vein, and right lymphatic duct will give the lymph, which is smaller. The right lymphatic duct will give the lymph to the right subclavian vein. So this is the right subclavian vein. So you see, finally the lymph or fluid that is given to the blood vessels, to the veins. Here you see this is the left subclavian vein, and you see here the thoracic duct is entering here, and this is the right subclavian vein, this one, right subclavian vein, and the right thoracic duct will enter here. You see this one. Okay, so cisterna chyli is lower expanded or dilated end of the thoracic duct, and it collects lymph from the lower part of the body. Lymphedema. Edema is the accumulation of fluid, right? That causes swelling. Okay, if the lymphatic vessel is blocked, okay, so what will happen? The fluid will accumulate in the interstitial spaces, and that area will become swollen because of the accumulation of fluid. That is edema, right? And distended. Okay, so the affected area. For example, this is your lymphatic vessel, and from the tissue here, you remember the fluid, interstitial fluid, enters into the capillaries, right? Now, if any blockage occurs in the lymphatic vessel, this vessel is blocked, so pressure will be high here, right? Because the fluid cannot get to the larger vessels. So the fluid pressure will be high here, so that will not let more fluid enter. So fluid will start to build up or accumulate in the tissue in this area, right? So this area will be swollen and edematic. So swollen and distended, and that is the lymphedema. Here you can see that it could be chronic, and that can cause the death of the tissue in that area, and a lot of accumulation of lot of fluid. Now lymphocytes, you remember I mentioned there are two types, T and B cells, right? About 80% of circulating lymphocytes, that means most of the lymphocytes are T lymphocytes, and they do phagocytosis. You remember I mentioned, and that's why this type of immunity given by the T cells is called the cell mediated immunity, because T lymphocyte is this one, and this is the antigen, and T lymphocyte will do what? Will engulf it, right? So the T lymphocyte directly gets contact with the antigen and will take it inside. So cell mediated. B cells are called antibody mediated, because you remember I mentioned B lymphocytes will secrete the antibodies, and the antibodies will then get attached to the antigens and will destroy them, right? So antibody mediated B cells and cell mediated or phagocytosis T cells. Okay, some lymphocytes can be converted to natural killer cells or NK. Okay, and these lymphocytes do immune surveillance, will check the status of the immune function in your body, will monitor. So the T cells could be 4 different types. Here you can see the cytotoxic T cells are also called natural killer cells or NK. They will directly attack the viral infected cells and destroy them. Helper T cells, another type of T cells, then you have suppressor or regulatory. Suppressor T cells are also called regulatory T cells. Okay, and there is another type that is called the memory T cells. These memory T cells would keep the information about the previous exposure. So once your body gets infected by a virus, your body will keep that information. Some T cells will keep that information. So when the same type of virus will try to invade into your body will respond quickly. So the chance of getting infected is less, right? Or sick is less in second time. Subsequent, infection would not easily happen. So that's the function of the memory T cells. These are antigen experienced cell, right? Before these cells were experienced that same kind of antigen and kept the memory of it. So natural killer cells or NK cells attack the foreign cells, viral infected body cells and cancer cells and will destroy them. Okay. B cells give the antibody mediated immunity, and that's why it is called humoral immunity. Humoral immunity, humoral, that word came from fluid. So antibody secretion, so it's like a fluid. So that's why antibody mediated or B cell mediated immunity is also known as humoral immunity. Okay, so some B cells you see are converted to plasma cells. So this is a plasma cell and this is a B cell. And some B cells are converted to plasma cells, and plasma cells can secrete plenty of antibodies. Okay. You remember I mentioned that after the lymphocytes are produced in the bone marrow, lymphocytes will go to the thymus or will stay in the bone marrow to get their training. So once they get their training or become immunopotent, they will come out as T lymphocytes or T cells, and those lymphocytes get their immunopotency in the bone marrow. Those will be the B cells. Okay, and natural killer cells also get their immunopotency in the bone marrow, and they will do the immune surveillance. In some places you will see natural killer cells are considered as one type of cytotoxic T cells. That's what I mentioned before. Lymphoid tissue. Inside the lymph organs like lymph nodes, thymus, spleen, tonsils, you will see those lymph organs are heavily filled with the structures called the follicles or nodules. So if you cut a lymph node, like this is a lymph node, you'll see many follicles or nodules, and these follicles are heavily filled with lymphocytes. Okay, so packed with the lymphocytes, they fight against the antigens. Makes sense? So follicles or nodules. And also other types of cells are present inside the follicles, mostly lymphocytes, but also macrophages, plasma cells. They are also present in the follicles. And in the late part of your small intestine, late part means the distal part, in the wall of your small intestine, you will see many follicles, and those aggregated follicles or nodules are called the Peyer's patches. So Peyer's patches are actually the follicles or nodules, but where in the late part of your intestine, or distal part of your small intestine. So here you see this is a section of the intestine, and you see aggregated lymphoid nodules or follicles. So you see many, and these are the nodules or follicles, and known as the Peyer's patches. Why in the late part of your intestine, you know, the food you eat, always with your food, the chance of microorganisms getting in is very high, right? And we all the time we are getting some microorganisms inside the intestine through the food. And in the wall of the intestine you have these aggregated lymphoid nodules or follicles to protect your body. So the antigens or microorganisms would be destroyed when they will try to enter into our body from the food stuff. Makes sense? So that's why you have Peyer's patches there to protect your body. Now the tonsils, the main tonsils are large lymphoid nodules. There are three types: pharyngeal tonsils, also known as adenoid, palatine tonsils, and lingual tonsils. Pharyngeal tonsils are present in the wall of the nasopharynx, attached to the wall of the nasopharynx. Makes sense? Upper part of the pharynx, which is the nasopharynx. Palatine tonsils, two, located posterior inferior margin of the oral cavity. You know the palate, right? Palate is the roof of the oral cavity. So behind the palate, you have the palatine tonsils. Lingual tonsils, lingual means tongue, and pair of tonsils located deep to the epithelium, covering the base of the tongue. So at the base of the tongue, you have lingual. So those are the main tonsils. Now, pharyngeal tonsil is also known as adenoid, and sometimes you know, when the tonsils get fight too much against the antigens, they also get inflamed, and that inflamed tonsil can cause pain and swelling. We know that sometimes the tonsils get enlarged when they fight too much against the antigens, and that becomes a problem itself. So in that case, if that person's tonsil is getting, you know, inflamed a lot, we remove surgically the pharyngeal tonsil. Since pharyngeal tonsil is also known as adenoid, the surgical removal of the pharyngeal tonsil is called adenoidectomy. Adenoidectomy. That means removal of ectomy is removal, surgical removal or dissection. So we remove the adenoid tonsil, that is called adenoidectomy. Now remember, the term adenectomy is different than adenoidectomy. Adenoid is pharyngeal tonsil, but adenectomy is removal of any gland. So slightly different, right? This is only pharyngeal tonsil, and this is any gland or part of it. Here you see this is the nasopharynx, so this is pharyngeal tonsil, this is the palate, so palatine tonsil, this is the tongue, lingual tonsil here. If you cut the tonsil and see under the microscope, you will see many folds. These are called the crypts, tonsillar crypts, like the folds going inwards like this. So these are the crypts, tonsillar crypts, and the fluid goes inside the crypts, and the antigens accumulate there, and that helps the tonsil to destroy them. Okay, and in the outer part here you'll see the follicles. So many nodules or follicles, you remember I mentioned that, and in the center part you will see the stem cells. That's why this is called the germinal center. So from the stem cells new lymphocytes are produced. Okay, so germinal center, and the follicles or nodules and crypts, those are present in the tonsils. Lymph nodes, you see the lymph nodes are kind of kidney shaped like this. Okay, and if you cut the lymph node and see inside, you'll see the outer part, and in the outer part you have many follicles filled with lymphocytes, macrophages and plasma cells, right? So these are the follicles in the outer part. In the inner part you will see the blood vessels, arteries, veins and lymphatic vessels. Now you see here, you will see some lymphatic vessels are bringing lymph into the lymph node. So these are the lymphatic vessels bringing the fluid or lymph into the lymph node, and these are the vessels taking the fluid out. So the fluid gets out through these vessels. So the vessels bring the blood fluid or lymph into the lymph node. These are the afferent, start with A, vessels, and those are taking out efferent, start with E. And the number of afferent is more than the number of efferent. Here you see they have shown 4 afferent, right, and only 1 efferent. So more fluid is getting in. So fluid is getting in fast but getting out slowly. So the fluid can stay inside the lymph node for longer time. Make sense? More fluid is getting in but getting out slowly, and that time is very important because fluid stays longer inside the lymph node and allows the follicles filled with lymphocytes to destroy the antigens. If they enter quickly and exit quickly, then the fluid will not be able to stay there longer time. Makes sense? So the lymph nodes will not be able to destroy the antigens, will not get enough time to do that. Okay, so that's the lymph node. Okay, the common clinical conditions are tonsillitis, inflammation of the tonsil that I mentioned. If the pharyngeal tonsil is inflamed, that will be known as tonsillitis 2, but in that case that's the adenoid tonsillitis. Appendicitis is the inflammation of the appendix. Appendix is also considered as a lymph organ because it is filled with, its wall is filled with follicles. Thymus is a lymph organ, and thymus is interesting because in early part of your life the thymus is very big, like occupies whole upper part of the thorax, but as you get older it shrinks and becomes very small. So in an infant, if you see, the thymus is pretty large, right, and in an adult it is a small pear-shaped organ that stays in the upper part of your thoracic cavity, so below the neck. And why the thymus is large in infants? Because you know that in infants the immune system is not yet matured or fully developed, so the thymus must work more. However, as the other lymphatic organs get matured, they take the responsibility and the thymus works less and shrinks gradually. Now if you see the thymus, thymus has lobes. Okay, it has two lobes, and inside the lobes you have many lobules. So here you see two lobes, right? This is one, this is another, and inside the lobes you have many lobules. These are the lobules. Okay, so right and left lobes and many lobules. Now if you cut the thymus, make a slice and see under the microscope, what you will see? You will see septa. Septa are separating the globules, connective tissue membrane, and inside the lobule you will see the Hassel's corpuscles or thymic corpuscles. Okay, thymic corpuscles are also known as Hassel's corpuscles. Okay, same thing. And inside the Hassel's corpuscles you have the thymic stem cells, and here we know that the Hassel's corpuscles or thymic corpuscles are the structures where the lymphocytes get immune potent. You remember I said that immature lymphocytes get their training or become immune potent inside the thymus, and it is speculated that the Hassel's corpuscles are the structures where the lymphocytes get their training or learn how to fight. Okay, spleen is a lymph organ, however it has other functions. You know that spleen is the site where the old blood cells are destroyed. So it is a site for the destruction of the old blood cells. So cleansing the blood by removing the old or dead blood cells, and that is not the immune function, right? That is a different function. But spleen is the site of immune surveillance and response. So spleen can monitor how much response should be. See the spleen. This is how a spleen looks like, and there is an area in the spleen that is called the hilum, through which the lymphatic vessels as well as the arteries and vein, splenic artery, splenic vein, and splenic lymphatic vessels pass. So you see the artery, vein, and lymphatic vessels through the hilum. Now if you cut the spleen and see inside, you will see some areas are white, some areas are red. So white areas are called white pulps, and red areas are called the red pulps. So you'll see red pulps and white pulps. Okay, why some areas are red? Because in red pulp area you have many sinuses, that means many spaces, and the blood accumulates in those spaces. Makes sense? So that area will look red, and the white pulp is the area where you have more like connective tissue structures. Okay, so those are the things you need to know from this part of my lecture, the lymphatic system. In next lecture I will talk about the immunity, the ability of your body to fight against the antigens. So lymphatic system supports the immunity, and we'll see how the body responds or fights the antigens. Okay.